Ernst, first of all, this question goes to you. At the height of the pandemic, an estimated 22 million Americans had lost their jobs. And that, of course, means that for most of them, they lost their health insurance as well. So in the Senate, if you're reelected, can you assure Iowans tonight that they will always have access to affordable health care insurance, even if they happen to lose their job in circumstances like we're seeing now during the pandemic?
Certainly, this has been a very difficult time for Iowans and, of course, all of America as we are going through the COVID-19 pandemic. So what we have to do is make sure that there is access to affordable, quality health care, which is where we are really working in the United States Senate and the Congress to find a way to provide affordable health care to all Iowans. What we have seen under Obamacare, while it did increase access to insurance, what it did not do was control the cost of health care. And that's why I've been diligently working across the aisle on a number of different packages, whether it is controlling the cost of prescription drugs. We did pass a law called the CREATES Act, which expanded access to various generic products, working with Senator Grassley as well to make sure that we are closing the Medicare donut loophole, is what they call it. And again, just making sure we have access to affordable insurance products, not what we have right now.
Senator, thank you very much. Theresa Greenfield, I'll ask you basically the same thing, but tell us really, what do you think Senator Ernst, what she should have done more, what she could do more to help unemployed Iowans?
From Iowa.
We have her just for a moment, but I'm not a lip reader, so I really can't understand what she's saying, as either can you. Steve, let's go back over to you and see what's up.
Okay, Senator, since you can hear us, your opponent supports a public option in health care, a plan that would create a government-sponsored health insurance plan that would compete with private health insurance plans. Republicans typically support competition in the market. Why do you oppose it here?
Yes, the public option that my opponent supports is just really a truck stop on the road to a single payer system or government takeover of healthcare. That public option, as done by a third-party independent study, could bankrupt up to 52 of our rural healthcare systems. You know, I depend on one of those rural healthcare systems. Certainly all of my family depends on those rural healthcare systems. Very important to those that live in the rural areas. So what we don't want to see is putting a bureaucrat between our physicians and patients. And certainly a public option, again, is that truck stop on the road to a single payer system. And we certainly don't need that.
But, Senator, some of those proposals for a public option call for higher reimbursement rates to rural hospitals. Couldn't that actually benefit them?
Well, that could, if we could get that done. And I would remind folks that as we sit in the United States Senate and in Congress, certainly there are fewer of us from those rural areas. And just trying to close that gap in Medicare reimbursements is extremely difficult. So again, having that public option, while it sounds great to a lot of folks, it does provide a pathway into a Medicare for all situation. And that's, again, not what we want to see. We want to provide access to affordable health care, but we do that by lowering prescription drug costs, lowering the cost of overheads for those healthcare systems, and certainly allowing that competition. So allowing insurance products to be sold over state lines. There are many ways that we can achieve parity and lower costs within the healthcare system, but a public option or a single payer Medicare for all type option is simply not the solution.
We've got a question for both of you. What should the federal government's role be in ensuring affordable, high-quality health care for all Americans? Ms. Greenfield, we'll go to you first.
Well, again, healthcare is the #1 topic that I hear from Iowans on, and they're struggling with the cost, premiums, deductibles, out-of-pocket expenses. It doesn't matter where I travel the state. Farmers are paying too much up in Fayette County. Moms are paying too much out in Waukee. And the federal government sets those rules, and what I support is expanding and strengthening the Affordable Care Act. We've got a lot of tools in our toolbox, and then creating a public option that will create competition in the marketplace, level that playing field, and make sure that every Iowan has access to high quality, affordable coverage. And it makes sure that we have competition and you don't have to rely on your employer. Right now, I have talked to folks who are entrepreneurs and they want to get started, but the cost of health care has kept them from doing that, forcing them to stay in a job instead of growing our economy with their creativity.
Thank you, Senator Ernst. Same question to you. What should the federal government's role be in healthcare?
Well, we do know that, #1, we have to protect pre-existing conditions. Now, my brother and sister are both type 1 diabetics, so I really do understand how important this is. And there is a way that we can provide a backstop for those that have the most medically complex situations. For example, Allie Steele of Dallas County, who has a congenital disease that requires a number of surgeries. And what we have to do is force insurance companies to make sure they're covering folks with pre-existing conditions. But we also have to make sure that those premiums are low for those families. Since the inception of Obamacare, when it went into effect 2014 until today, for those that are purchasing insurance policies, the premiums have doubled. The premiums have doubled. So Obamacare has actually driven the cost of our premiums up. We know that those out-of-pocket costs have gone up, the deductibles have gone up. And so what we have out there are products through those insurance companies, through Obamacare, that our Iowa families simply can't afford.
Thank you, Senator Ernst. We're going to now head over to Ms. Teresa Greenfield. What would you do to ensure rural Iowans have access to the same level of health care as those living in urban and suburban areas?
Well, I have to tell you, I wouldn't do what Senator Ernst did, which is to vote repeatedly to end the Affordable Care Act, gutting protections for pre-existing conditions, gutting coverage for prescription care, mental health care, maternity coverage, and of course, threatening to end Medicaid expansion, which has been a lifeline to our rural hospitals. I was just out in eastern Woodbury County and talked to a family who's already driving 25 miles to get groceries and to get to a clinic and a hospital. We have to make sure that we're strengthening and enhancing the Affordable Care Act, protecting Medicaid expansion, which will help keep those rural hospitals and rural health clinics open, and again, making sure that everyone has coverage for all of the essential services that were provided in that plan. Senator Ernst, again, has voted repeatedly to end the Affordable Care Act and end your protections, taking away your health care.
Thank you, Ms. Greenfield. We're now going to head over to Senator Ernst. She did mention your name. You have 30 seconds to respond.
Yes, thank you so much. And again, the Affordable Care Act, while it expanded access to insurance, it did absolutely nothing to control the cost of health care, which is why I have worked in a bipartisan manner to make sure that those with pre-existing conditions are covered, providing that federal backstop for those that have the most medically complex situations. I am a huge supporter of our community health centers and our rural health care systems. It is very important that we are supporting those, but the public option that Ms. Greenfield keeps referencing would drive 52 of our Iowa hospital systems, those rural healthcare systems, out of business.